82% of New Zealanders are now fully vaccinated, compared to just 23% 3 months ago. And by mid-December, it's expected to be around 90%. That is phenomenal. On November the 29th, Cabinet will confirm the decision to move Auckland into the new traffic light system. As we have already signalled, we expect that move to occur soon after Cabinet meets, and that Auckland will initially move into red, the highest level in the traffic light system. At that same meeting, Cabinet will confirm that the rest of the country will move into the framework at the same time as Auckland. With safety and minimising the spread of the virus in mind, I can also confirm that Cabinet will look to move those areas with lower vaccination levels into the traffic light system at red. This will add protections and hopefully also support an increase in vaccinations. Aucklanders have faced restrictions for an extended period of time to keep the rest of New Zealand safe, but the time is coming to change the way it works. That's to allow all New Zealanders to reconnect with one another over summer as safely as possible, but also because, of course, we have high rates of vaccination now in Auckland also. Today, I can announce that from the 15th of December, people travelling out of Auckland who have either been fully vaccinated or have a negative test 72 hours prior to departure will be able to leave Auckland and visit other parts of the country. This means you'll be able to enter or leave Auckland for any reason. The requirement to be tested or vaccinated before departure will be in place for the core summer period of the 15th of December to the 17th of January. As always, police will have the operational discretion on the enforcement of these rules. It is intended that people breaking the rules will face an infringement fine of $1,000. A significant amount of movement happens across the country during this period, so we have added this safety net to reduce spread, but have also been pragmatic. We set, for instance, drink driving laws with penalties, expect them to be upheld, and police undertake in those cases random spot checks on our roads to ensure that they are. We'll take the same approach here. Now, on the northern boundary and the gateway to Northland, the police will work with iwi to ensure people can move, but also that the people of Northland have confidence in the checks that are in place. Checks for travellers out of Auckland Airport will be done at check-in. As you know, Air New Zealand have also made a vaccine certificate or test a requirement before you fly, and these requirements begin before the 15th of December also. We will also be enabling inter-islander ferries to require proof of vaccination or a negative pre-departure test in order to travel between Wellington and Picton. As you can see, we have given special consideration to the South Island. The combination of the vaccine or testing requirement for Air New Zealand, combined with the ability for the inter-islander to operate the same regime, will mean all entry points to the South Island will be well covered with checks to try and slow any potential spread to the region. This overall represents a significant shift for New Zealanders, but we have a plan and you can build your own plan too. Get your vaccine and your vaccine pass ready and continue to follow public health guidance. Cabinet is making a number of decisions in the coming weeks that are about preparing for the shift to the traffic light framework. Earlier today, Minister Hipkins provided details on how people can access their My Vaccine Pass. The Vaccine Pass is your ticket to summer and is essential under the traffic light system, so you can get ready and prepare by downloading it today, and we are aware that over 60,000 people have already done so since 9 a.m. this morning. Minister Little, Sepuloni and Verrill will set out how testing, contact tracing, care in the community and social support will be provided for those who may be infected with COVID-19. With fewer people needing hospital treatment because of vaccination, it's important that the model of case identification and community care is robust to ensure everyone is well looked after and that we reduce the risk of onward spread. We'll also release detailed individual sector guidance for the new traffic light system. This has been worked through in detail over the course of many weeks in consultation with different sectors in preparation for the move to the new system. As I said earlier in the week, the traffic light system is safer than the alert levels. For example, currently in a region at level 2, everyone can go into a hospitality setting, vaccinated or not, with the level 2 key restrictions of seated and separated. However, at red in the new framework, you will also have to be vaccinated, which adds an extra layer of protection. We have worked hard to get as many people vaccinated as possible. The response from New Zealanders has been incredible. As I've said, 91% first dose and 82% fully vaccinated. We know there are still some making the decision over whether to be vaccinated, but we need to make decisions now that will protect them and others. It's a very important point I want to highlight. The new system recognises disparities in vaccination rates and the risk of the virus to vulnerable communities. The government is working with iwi leaders and Māori health providers to keep accelerating the Māori vaccination campaign, and we remain committed to working with and supporting those who are hesitant about getting the vaccine, and our job isn't done until everyone has that opportunity to be vaccinated. But the framework helps protect unvaccinated people in the meantime by minimising spread. All in all, the traffic light system is just better designed for our new strategy to minimise and protect against COVID-19 and is more fit for purpose than the alert levels. It also offers greater incentives to be vaccinated and greater protections for those who are and aren't. That's why it's time to get ready to move. I thank New Zealanders for their ongoing efforts to rise to the challenges of this pandemic. We adopted some of the most stringent tools to eliminate the outbreak of the virus, and we succeeded. Our alert level system helped us to avoid the worst of COVID-19, allowing us the ability to vaccinate our people before Delta reached many. We now have an updated plan to protect ourselves over the next stage of the pandemic, starting with high vaccination rates, My Vaccine Pass, and our new framework. It has been a year, 2 years of constant change caused by COVID-19, but we've had a plan and it's carried us through. And while this may be one of our toughest periods to date, we are well set up with our new plan to carry us through to the next stage. While I know there will be some who will think our moves too fast, others too slow, I have no doubt that this is the best plan to keep us safe and allow us to connect once again with friends and loved ones, and to ultimately transition us safely to a new way of managing COVID-19.